Pediatric scoliosis is one of my passions. Taking care of kids with spinal deformity is something that I knew I wanted to do from the very first day I got into practice. And I've worked at developing a practice that partially specializes in pediatric scoliosis. It used to be that schools did screening, and so they would have every year kids, usually between the ages of 12 and 14, they would do school screening. That stopped about 15 years ago, and so it was really left to the primary care physicians to notice whether or not a child has scoliosis. As a parent, what you can do is you can look at your child's back. Are their shoulders level? Are their shoulder blades level? If you have them bend over, is one side of their ribs higher than the other? About 3% of kids have scoliosis, but only about 0.1% of those actually is bad enough where we have to do surgery on them. You know, just because you have it doesn't mean you're going to have surgery. You may just be observation where we just follow you along, or you may have to have a brace, kind of like you get braces on your teeth, and only the most severe cases do we actually have to do surgery on. We were recently, in the last 2 years, able to obtain an EOS Edge, which is a special x-ray machine that is fantastic, both for adults, but especially for kids, because the radiation dose is so small. Kids who have scoliosis get followed every 4 months, and they need x-rays. Since we've been able to purchase one and have it at our Allisonville office in Fishers, I've developed a scoliosis clinic every other Friday where we try and focus really on kids. We may have a few adults that are coming into the clinic at the same time, but predominantly it's kids. And I think kids feel better being around other kids who have the same problem. There's a company out there that makes these little bracelets, and there's one that's in support of the Scoliosis Research Society. And I buy them for all of my kids. All of my kids who have scoliosis, I give them a present and I say, hey, you're part of the club. And I think the kids in the waiting room, when they see other kids with the same bracelet, they know they're not alone, that other kids have the same thing and they're going to be fine. So doing this Friday clinic has been a dream of mine, and I'm just ecstatic that it's taking off and we have all of the cutting edge equipment we need to take care of these kids.